One of the indications for somebody to be able to deliver normally after a previous cesarean section is that the pregnancy interval should be appropriate. That way, we would be assured that the risks of uterine rupture are minimal. And according to the standards, international standards, we would expect you to have at least 18 months of interval between the previous cesarean section and the current baby you're going to deliver. Although in some jurisdictions, some doctors extend up to 2 years, but generally we would expect within 18 months that the uterus should have healed adequately well for you to be able to try labor. 2, the size of the baby. If the baby for some reasons is quite big, we will know that at times the labor will be a bit difficult, but generally we would expect you to try when you have a normal sized baby, and that way we would know that the labor can be able to progress normally. And thirdly, if for some reasons, if you are aware that you were operated not because you had a problem either with the inadequate pelvis or you did not have any history of a pelvic injury before, we would be able to allow you to try to deliver normally, because if you had history of a pelvic surgery, or if you've had if you are being determined that you've had pelvis which is inadequate, it is very unlikely that your pelvis would have grown within this short time for you to be able to try to deliver normally. So usually people with obvious cephalopelvic disproportion because of a narrow pelvis of the mother, we would also not encourage them to be able to deliver normally. Meanwhile, if you've had adequate pelvis, for some women even previously, maybe they had delivered one of their children before, then they got a cesarean section either due to some emergency. In a situation like that, we should be able to encourage this mother to be able to try to deliver normally. Another usually very good opportunity for somebody to be able to have trial of labor after cesarean section is if you've had, for example, spontaneous labor. Usually, we wouldn't want to start things like induction on a previously scarred uterus, because if it is a natural labor, things would go normally, and then we'll be able to observe you closely. And so spontaneous labor is extremely very important thing. In many facilities, doctors will not be comfortable to be able to allow you to be induced so that the labor progresses. Although careful induction, especially using oxytocin, if you've had a very good Bishop score, a Bishop score is usually an examination we perform before an induction is commenced, to look at how the cervix is, the position, how soft it is. I want to see if it is thin. We want to see if the location, the position, is it anterior, is it posterior, is it central? We want to see that the consistency is good. So usually those are some of the parameters we see when we're doing Bishop score, and even modified Bishop score. We actually consider the presenting part to how far the baby's head is. This baby engaged, or is it still high up in the abdomen? All those can be able to guide us in making a determination of the success rate of induction. So there are also tools which we can use and to determine the success, the probability of the success of an induction. So in it there are many things, including maternal height, including the BMI of the mother, because we know that in majority of mothers who are obese, usually the risks of them failing to deliver normally is increased, because general obese mothers also have big babies. So there is a tool we use, the maternal height, the maternal BMI. We want to know if previously this mother delivered, or if she has even had a VBAC before this particular pregnancy. So there are tools which we use to be able to ascertain. But generally speaking, if you've had a previous cesarean section, trial of labor is an unacknowledged practice. All you need to do is to discuss with your gynecologist, so that you can be able to be assessed to see if you're fit to be considered for trial of labor. And just like any other mother who comes to labor, a mother who is under trial of labor should be observed closely, so that if there are any observed failure to progress, or if for some reasons all of a sudden you see any changes in the fetal heart, you should be in a facility where you can easily access surgical services. So we don't do trial of labor from home. This is a caution to all mothers who have been operated before. If for some reasons your doctors have told you you cannot deliver normally, don't hide at home thinking that you'd come later when the labor has commenced. At times it can be very risky to you, because the risks of having a bad outcome both for the mother and the baby can be increased. So this discussion should commence early enough. In good facilities, you should be able to have a delivery plan with your gynecologist. For those of you who have never subscribed to my channel, I kindly request you to subscribe to this channel, like this video, and share it with your colleagues, so that other mothers can be able to benefit from it. Thank you.